appearance, and also here the cell is pigmented due to cytochrome pigment present in the mitochondria. As regards the EM, you will see that it has a lot of mitochondria, and they are spherical and not filamentous, in addition to the multiple fat droplets, and the nucleus, of course, is rounded, not flattened like that of the white cell. What is the function? The function here is heat production or heat generation and not heat insulation. What is the cause of heat generation here? The cause is that this cell contains a protein called thermogenin. This protein is present in the mitochondria, and it is a specific marker for the brown cells. So don't forget that the mitochondria here are numerous, and they are spherical in shape, and they contain cytochrome pigment, which leads to the appearance of the pigmented cell, and also contains the protein called thermogenin. At the same time, the fat cells as a whole have an endocrine function, as they secrete leptin. What is the leptin? Leptin. This leptin is a hormone which regulates the appetite and the amount of the adipose tissue in the body. So leptos means thin. So this leptin, it prevents the hunger sensation when the fat is so much in the body. This is the macrophage, which is one of the connective tissue cells. It has two forms. The fixed form, which is called histiocyte. Histo means tissue, so that it is affixed in the connective tissue. And the other type is the free macrophage. This is a histiocyte or a fixed macrophage, where you can see in the liver tissue. Here we have, these are the cores of the liver cells, and in between we have the blood sinusoids, and in this wall of the blood sinusoids we have this macrophage. And these cells are stained by vital stain as India ink in this picture, and can be stained also by trypan blue. They are vital stains that are engulfed by the histiocytes, and after that the animal is killed, and the specimen is stained after that with hematoxin AUC, and the only cells that will take the vital stain will be the histiocyte or the macrophage. As you see, we have here phagocytosed particles of the stain inside this histiocyte. This histiocyte originate from the blood monocytes, and their site, it is present in the connective tissue, mainly around or over the collagen fibers and near also to the blood vessels. As regards the LM, they are large and branched, not small, large branched cell. Very important, they have many folds representing the pseudopodia of these cells. Also, the cytoplasm is highly granular due to the phagocytosed particles, and it has a large kidney-shaped nucleus similar to that of the monocyte, and it can be demonstrated, as we have said, by vital stains. Not only that, but I can demonstrate by the light microscope the presence of the lysosomes using the acid phosphatase test or the acid phosphatase histochemical staining mentioned in the cytology. These cells are, as regards the electron microscope, they are characterized by the following. Number one, they are having many irregularities or folds on the surface of this large cell. This is very important. Number one, the surface is irregular due to the pseudopodia in addition to the other folds on the surface and the microvilli. After that, we have phagocytosed particles, a lot inside this cell. In addition to lysosomes of different types. We have a lot of lysosomes of the different types you have studied in the cytology. In addition, of course, to the residual bodies, which are one of the types of the secondary lysosomes. Also, we have, this is very important features, the folds, the phagocytosed particles, number one, the phagocytosed particles and the different types of the lysosomes. Also, you can see also the Golgi apparatus and also in addition to the normal organisms as the rough endoplasmic reticulum. Then you have to remember carefully the functions of this cell. The functions of this cell is related, of course, to their phagocytic power. Number one, it is the removal of all the antigens that may invade the connective tissue and different, of course, microorganisms. Number one, اللي هو removal أو engulfing أو phagocytosis of the different microorganisms. Number two, help to clean any wound by removing the debris اللي هي البقايا الحاجات dead cells to be removed for easy and rapid healing. So clean the wounds. Number three, they are also antigen presenting cell. They phagocytose the antigen and after processing they present some of it on its surface to stimulate the immune system in the form of the lymphocytes. So it sends a warning for the lymphocytes. Number four, when the presence of a large foreign body in the connective tissue, they unite together to form a giant cell, foreign body giant cell. So we will have, after this union, a big cell with multiple nuclei that will engulf this foreign body. This cell is called foreign body giant cell. After that, also, it forms different enzymes that will help penetration of the connective tissue, like the collagenase enzyme to cause lysis of the collagen fibers, and cytokines, both of these materials are important in the defense and as well as in the repair. Number 6, she is the last function here, will be the destruction of the old RBCs. The RBCs which are old are destroyed by this phagocytic cell inside the liver, as well as the spleen. So the functions again, number 1, phagocytosis, number 2, cleaning of the wounds, number 3, formation of foreign body giant cell, number 4, here the production of the collagenase and cytokines help in healing and repair of tissue, and number 6 is the phagocytosis of all the RBCs in the liver and the spleen. This is the mast cell, which is a free connective tissue cell originating, number 1, from the UMC. Origin from UMC in the bone marrow. Number 2, the site, it is present very near to the blood vessels. They are present very near to the blood vessels, especially in the respiratory system as well as the digestive system. Respiratory and digestive. Number 3 is the LM. As you see here, in the LM picture, it is oval cell, and the nucleus is rounded, and the cytoplasm is granular, and these granules are stained, can be stained. These are basophilic by the hematoxin, but they can be stained by the toluidine blue. Here, the stain, it is a metachromatic stain where you can use toluidine blue to give another color than the blue color of the original stain, which will be, as you see in this picture, purple or red color. So these are mast cells stained with metachromatic stain like toluidine blue to give a purple color here in this photo, or a red color in the upper one. This is a very important character for this cell. As regards the features of the electron microscope, you will see number one, the presence of these electron-dense granules. These are the secretory granules of this cell, in addition to the features of protein-forming cell, which are the following: the presence of well-developed RAF and Golgi, in addition to mitochondria. What are the functions of this cell? The functions will be the following. Here, the first entry of the allergic material will cause the development of immunoglobulin E antibodies, and the receptors are present on the surface of the mast cell. These are the antibodies after the initial entry of the allergic material, attached to receptors for these antibodies. When this allergic material enters the body again, in this case it will be connected to these antibodies, connected to the receptors on the mast cell. And this event will cause the release of the granules produced by the mast cells. What are the contents? We have the histamine that causes vasodilatation of the blood vessels, so that here the pores here in the wall of the capillary will be wider, and this will allow the passage of the white BCs to the connective tissue for immune reaction. Not only that, but also it produces the heparin. The heparin prevents the clotting of the blood, and this also helpful in this reaction. Also, it secretes eosinophil chemotactic factor that will attract the eosinophils, which is one of the blood cells, to the site of this allergic reaction to destroy the histamine after performing its function by histaminase enzyme. Also, it produces leukotrienes. This material will cause the contraction of the smooth muscles, so that if it occurs in the respiratory system, the smooth muscles of the bronchioles will produce a spasm, and this will cause the symptoms of the bronchial asthma أو الربو الشعبي. This is the plasma cell, which is also a free connective tissue cell, and as you see, this is the light microscope picture, and this is a diagram for the light microscope picture, and this is the EM picture. First of all, you have to study the origin. It originates from the B lymphocytes after its activation to form plasmablast and then plasma cell. Site, it is very common in the lymphatic tissue. Then we have the LM. The LM here, the size of these cells, it is a large oval, but the size here is about 20 micrometer. Large oval, 20 micrometer in its size, and the cytoplasm, as you see here, it is basophilic with a negative Golgi image. Here it is unstained area due to the presence of Golgi well developed in this area, so this is the negative Golgi image. And the nucleus here, as you see, it is very characteristic for this cell. It shows cartwheel appearance. This is due to the alternating bands of heterochromatin with euchromatin, looking like the face of the clock or the cartwheel. And this is a very specific feature for this cell. Sometimes you can see under the light microscope, here it is a light microscope, sometimes you can see acidophilic bodies here. These bodies are called Russell bodies, and they are suggested to be accumulated antibodies inside the cells. Then, as regards the electron microscope, it is a protein synthesizing cell as it produces antibodies which are glycoprotein in nature, so that you can expect to have a well-developed rough endoplasmic reticulum